What is the normal behavior of ISQ with time? This is what is in the literature for many years, that we have initial stability, and then between 3 to 4 weeks break of stability, and then we have again the stability to recover. Of course, it depends on the type of bone that you are putting the implant, but this is the basic information that we have on the literature. And because I'm a little bit curious, and some years ago in our university, we did a study in the worst case scenario, that is the posterior maxilla. As we know, the posterior maxilla has a very soft bone and normally has lack of quantity also, because we have the pneumatization of the sinus. So we thought, okay, let's try to evaluate the primary stability and the evolution to secondary stability in 3 levels of maxillary bone generation. And we have a group with healed bone, a group with simultaneous graft till more or less 50% of the implant area, and then we have the group of sinus lifting filling that has more than 50% of regeneration before the implant placement. And we compared this, and what was very interesting, it was the results that we had in this study, because being the worst case scenario and having this stability in the healing was quite surprising. And of course, there's a lot of ways to explain these results, but mainly the macro structure of the implant, in this case, because it's a knife thread implant, I think it's a major characteristic that made this possible. Of course, the microstructure is also important, but the macro design probably it was the main factor that allowed these results. So these results are true for this specific type of implant, but not for all the implants. And if someone is interested, can send an email by the chat, and I can send the full article so you can appreciate better.